providing care to cancer patients. Hello, I'm Kelly Lynn, and this is Comcast Newsmakers. Joining me at this hour is Dr. AnuGupta. She is Medical Director of the Cancer Center at Gaithersburg. Thanks for being here.
Thank you.
Tell me a little bit about this new state-of-the-art facility. What does it offer?
So the Cancer Center at Gaithersburg is recently opened in the heart of Montgomery County. We do all forms of radiation therapy at that facility. It's also equipped with the most state-of-the-art radiation treatments known as stereotactic radiosurgery. It delivers that treatment with the only technology of its kind in the area. So I'm very proud of the fact that now you've got the most up-to-date technology right in the heart of Montgomery County, close to home. The closest facility that would offer such treatments on this type of machine is at Johns Hopkins.
All right, and you pretty much offer care to all kinds of different cancer patients.
Yes. So the Cancer Center at Gaithersburg treats a variety of malignancies, some of the most common ones: breast, prostate cancer, lung cancers, gynecologic malignancies. So it's a full-service center.
I'd like to talk a little bit more about Cervical Cancer Awareness Month, which is in the month of January. What do you want people to know about that form of cancer?
So cervical cancer is the leading cause of cancer deaths worldwide in women. In this country, we're fortunate enough to have screening pap smears. So the incidence of cervical cancer is about 12,000 cases diagnosed per year. Worldwide, however, just to put it in perspective, there are about 500,000 cases diagnosed worldwide. So it's a serious malignancy across the world. One message I think we've done a very good job of as physicians is getting across the importance of screening. Certainly.
The American Heart Association, the American Cancer Society is reporting that cancer rates are on the decline. That might be surprising news for some people. What do you attribute the decline to?
So the cancer rates are on the decline for some very common malignancies, for breast cancer, for prostate cancer, for lung cancers, and some of that is from screening. Mammograms have altered the stages at which breast cancers are being diagnosed dramatically, but it's also because I think treatments have progressed, such as radiation treatments, chemotherapy. And so we're finding that some of the most common cancers are actually becoming more chronic diseases than they are the fatal ones that they used to be.
What are some of the important things that people should keep in mind when it comes to reducing their own risk of getting cancer?
So we have to still, even though incidence of cancers may be declining, it is still the second leading cause of deaths in Americans. And a significant portion of that is due to smoking. So obviously one good way to prevent it is don't smoke. The other one is diet and exercise. Very important, and get your screening exams done.
When you talk about diet and exercise, what kinds of diets should people be committing themselves to, and what should they avoid?
So low-fat, high-fiber diets will lower the incidence of colon cancers, for example. And more importantly, they're also good for your heart, which is the #1 cause of death in Americans. So you eliminate or lower the risks of both of those, heart disease and cancer, just by diet and exercise. And by exercise, that doesn't mean start running marathons, but 30 minutes 3 times a week is a pretty good regular routine that you should be able to manage.
Sure, it sounds like it. Let's talk a little bit about the facility again. Tell me about some of the cutting-edge procedures that people will find there that they might not find at some of the other places that are around town.
So as I said, stereotactic radiosurgery is high-precision radiation treatments designed to treat tumors as small as 1 centimeter or ½ an inch in size, and that is a treatment that we do offer there. It is currently found in many academic centers, but the technology that's at the Cancer Center, as I said, is very similar to what's available right now at Johns Hopkins. So that's one thing. We also have a CT scanner, which is also one of unique scanner that's available at the center.
Very nice. And for more information, people can simply go to your website?
Most definitely. There's a lot of information on the website, and as well as information about treatments for various malignancies.
All right, thanks so much for being here, Dr. AnuGupta, and we thank you for watching Comcast Newsmakers. I'm Kelly Lynn.